our review for nutrition. Here we are going to start reviewing our lecture 1 till lecture 7. Okay, so this is a review. This is not really technically a lecture. So I'm going to highlight the topics that are I consider relevant for your course. Okay. All right. So one thing I want you to remember here is the RD, the registered dietitian. So that is actually the one who is going to be officially a better request in order to have your needs of calories every day, not a nutritionist. The nutritionist is actually an empiric person. Okay, so just to talk about carbohydrates, fat, and proteins, just to review, what are the nutrients? The nutrients are going to be the micronutrients, is going to be the water. So there's 3 components: macro, micro, and water. Macro is going to be carbohydrates, fats, and proteins, and micro are going to be the vitamins and minerals. I'm going to ask what for do we need vitamins and what for do we need the minerals. And water is the medium where all the chemical reactions are going to occur. Okay, so we are going to talk about the percentage in the next lectures. Okay, so let's start to talk some shortcuts, talk about proteins. The proteins that is lecture 1 and lecture 2, proteins basically are formed by amino acids. So we have amino acid. So this group COOH is acid, the group NH3 is the amino. These proteins, if you what is the difference between these proteins, macronutrient, with the rest of the macronutrients? Is this, the nitrogen. Don't forget about the nitrogen. Carbohydrates do not have nitrogen. Lipids do not have nitrogen. Why is so important about nitrogen? Nitrogen, I consider this as the cement to build up structures, cement. So if you don't have cement, any building can be built up. So is the protein the only one who contains this nitrogen that is going to be used to, for example, repair tissue, maintain tissue, and replace tissue. So remember that our body is permanently, constantly changing. Are going to replace, maintain, and repair tissue all the time. Right now, in this moment, there is always a vessel, capillaries that are being broken, and actually the body is going to replace them based on proteins. Okay, and the nitrogen. Just to refresh a little bit more here, the proteins are going to be used. The proteins are not used for energy. You can use proteins for energy when you deplete all the carbohydrates, you deplete all the lipids. That is the moment that the proteins are going to be used as energy. Before that, no. So basically, when you have bone skin, you start to use your proteins. Now, one more thing: proteins cannot be stored. Proteins cannot be stored. So if you have an excess of proteins, that is going to be eliminated. So basically, you're going to use, or you're going to require proteins every single day. Okay, so that is about what we want to do about proteins. One more thing is that excess. Imagine that you have proteins and they take some proteins for, they're going to, each cell is going to take the amino acids to produce their own proteins. The excess of proteins that is remnant are going to be eliminated and take it, they're going to take away the amino, producing the ammonia, and the ammonia is going to produce, take it by the liver, and the liver is going to produce the urea. Urea, okay, urea, and the urea go to the urine. Okay, so that is going to take us to one concept that is what? The protein balance. So we have the nitrogen, protein balance, nitrogen balance, sorry. We have positive nitrogen balance and we have negative nitrogen balance. So how to measure this? These are going to be measured in the urine through the urea. Urea. So urea. So if you just remember the cats they eat a lot of proteins. So they have actually always positive nitrogen balance. Who else are going to have protein balance and positive? Are going to be pregnant, bodybuilders, So they have a lot of protein, but they cannot store protein. So that protein are going to be deaminated, go to the liver, the urine, and you find urea in the urine. So you take samples of urine, urea is present. That means that patient or that person have a positive nitrogen balance. Okay, and who is the negative nitrogen balance? The negative nitrogen balance are going to be patients who are sick, some infection, patients who are having burns. So these patients who are sick, infections, burns, are tissue that are being destroyed. So the tissue, what it's doing is to build up, to repair the tissue. For that, the body is going to use all the protein necessary on your body, and that is going to be used to repair and replace the damaged tissue. So if you take the urine test, and you will not find urea at all, because there is all the proteins are being used for that purpose, to repair the tissue. So positive nitrogen balance, question for the exam, pregnant, bodybuilders, and negative nitrogen balance are going to be burns, infections, or any disease. Okay, so now, talking about the vitamins and minerals, so the vitamins are actually what we call the cofactors. Sorry, it's just me. Sorry. All right, so vitamins are going to be called the coenzymes. And the mineral is going to be called a cofactor. So cooperation. They are going to cooperate. These vitamins, you can call them coenzymes. These minerals, you can call, one of the functions is the cofactors. What they are going to cooperate with the enzymes. If you have A plus B to produce a product C, we have an enzyme that is represented in this curve. Enzyme. What is doing this enzyme, and why is this curve here? So A plus B is going to give you C. For example, let's put it this way. For example, let's see, water plus carbon dioxide. Well, I mean, for carbon dioxide is going to produce the bicarbonate plus hydrogen. Okay? So this reaction A and B is going to produce C. Indeed, well, let's put C. So this enzyme is coming to this reaction, and this curve means the enzyme is coming to accelerate the reaction, and they are going to not be part of the product. They are going to return and recycle for the next A and B. So this enzyme will never going to be part of the chemical reaction at the end. So this enzyme, what it's doing is to just accelerate. So now, if you have a car I don't know if that's a car. Okay, whatever. And actually, you want to push the car. You want to push the car. It's only one person. All right. This car probably is going to move slow. But if you're going to have two people pushing the car is going to go even faster. Okay. So this car is going to be the chemical reaction. This car is a chemical reaction. And the guys are going to be the enzymes. These enzymes are going to cooperate to make the car go faster. So that is what it's doing. In this enzyme, what is coming is the coenzyme, and this coenzyme is the extra guy who is going to push the car and make it run faster. Okay. In addition to that, we have the minerals that is called the cofactor. Cofactor. All right. So for this, I want to mention something about the cofactor and the coenzyme. For example, we have the vitamin K. Vitamin K. Vitamin K, as you know, is going to participate in the secondary coagulation, or called the secondary hemostasia. So that means that the secondary hemostasia, we have the primary are the platelets, and the secondary hemostasia are the coagulation factors. What is the relation with the vitamin K? So we have certain coagulation factors are produced by the liver, correct? Are produced by the liver. And we have certain proteins. We have certain turn into protein 12, 11 is going to go to protein 5, protein 4, protein 3, protein 2, and protein 1, that is the fibrin. All right, so here we have certain reactions, 12 reactions. One reaction produce 12. This reaction is going to produce 11. So on until produce the fibrin. In these reactions, we have enzymes. And in these reactions, in some of them are going to participate the vitamin K. Is the second guy who pushing the car. So the vitamin K is going to even accelerate even more the reaction. So you don't need to wait a long time. For example, another reaction, if you are weak and you are probably hypoglycemic, you take some sugar. So you don't wait 3 days to feel better, right? So you basically in few seconds you start to feel the boost of the glucose in your body. So that is how fast is going to be the chemical reactions. And the vitamin K is going to participate in the formation of the fibrin, that without the fibrin, you cannot produce a clot. What is a clot? It's red blood cell, that is the component, plus platelet, that is the primary coagulation, plus the fibrin, that is the secondary coagulation. These three together form a clot. If you don't have the fibrin enough, you cannot have a clot. So you can have the platelets, but that is not a clot at all. It's not a clot. It's not functional. Okay? All right. So in addition to that, we have in this coagulation factor, there is another element that is going to accelerate. It's the third guy who is going to push the car and make it faster. And that is the calcium. Calcium. Calcium is going to be the cofactor. So this is a very good example where you can tell that in this chemical reaction, we have the coenzymes participating in the chemical reaction and calcium that are going to do the same. Okay, so that is one of the functions of vitamins and minerals. That is one of the examples. And just to finish this, because I'm trying to make shortcuts for the vitamins and minerals that we are going to mention, especially the vitamins, is just a moment. Okay, so the vitamins are going to be when you have the deficiency of vitamins. Please, we have different type of vitamins. It's very rare that only one vitamin is deficient. It's not that common. Basically, you have a combination of deficit of vitamins. Why? Because the vitamins, as you know, is part of your diet, is part of the vegetables, the salads, and if you don't eat that much, you don't have enough vitamins. And what happened with these vitamins? Again, regeneration, replace of the tissue, maintenance of the tissue. The house is always being, you need to clean the house every day. You need to, if you don't clean the house, you don't repair tissue, the things in your house are going to decay and get broken and it's not going to use anymore. So these vitamins are going to produce help to the regeneration, to the replacement of the cells and tissue that are being damaged. If you have deficit of vitamins, the regeneration will not happen. The replace of tissue will not happen. The maintenance are going to be very poor. So you start to have lesions on the mouth, lesions like ulcers, cankers, right? Cheilosis. So something that you already saw in your class. So that's why the deficit of vitamins are going to help to regenerate, replace, and maintain the tissue that is being need to be replaced. Okay. All right. So we got that. Well, I don't know why I put this. Okay. All right, so regulation and control, we have vitamins, coenzymes, minerals, cofactors. We already talked about that. Water is going to be essential for metabolic process. That is the medium. So don't forget that, never, please. It's the medium. So what you need to apply? You need to apply saying that if you are dehydrated, you don't have enough water. So the chemical reactions do not have a medium where to go. So you have a car, you don't have a highway where to go. So you cannot go any place. So you cannot reach your goal to replace, maintain, and replace the tissue. Fiber. Fiber, don't forget about the fiber, please. Fiber. Fiber, I included here because fiber is one of the important things that we need to, I'm going to take my extra time here. All right, so let's talk about the fiber. Fiber is cellulose, right? It's coming from the vegetables, fruits. Okay. All right. So this fiber is going to be cellulose is not digestible. So you cannot digest. You cannot digest the fiber. So the fiber cannot be digested, cannot be broken down, cannot be absorbed. It's not absorbable, right? So cannot be absorbed. So this fiber is in the intestines are going to contain a lot of vitamin because that is coming from the vegetables and fruits. So they release the vitamins, and the minerals. They release the vitamins and minerals, and the fiber stay in the lumen of the intestine. This fiber then is going to be eaten by the bacteria, and the bacteria is going to produce vitamin K that is necessary for the for the coagulation process. Okay, so this fiber, in addition to that, oh, sorry, what happened? Okay, oh, I don't want close-up caption. Sorry. Okay, so the fiber, what I'm going to tell you is the fiber is concentrated in the lumen. This is the lumen of the intestine. High concentration, right? High concentration of fiber because they cannot be absorbed. And you know by the universe law that if you can, the outside here should be equal concentration than here, but it cannot. Why? Because the fiber is high concentrated, cannot pass to the other side to make it equal concentration. So what is doing the body? The body is going to bring water into the lumen, water. And that water is going to try to dilute the fiber in order to be equal concentration outside and inside the lumen. So that water and the fiber are going to do what? It's going to form the stools, form stools, form stools. The fiber, in addition to that, why is it important to take fiber? If somebody can open your microphone and tell me what is doing the fiber what is doing in addition is to decrease the cholesterol in your blood. How come? How is that cholesterol can help us? How this fiber can help us to decrease the cholesterol in our body? All right, so the fiber, I want you to remember that is like a rope. The rope. We make a rope like this. The rope has a lot of fibers, correct? So let's represent that. I'm not saying that it's a fiber, that represent like a rope. A rope. I want you to put this rope in oil. In oil. Okay? So it's totally surrounded by oil, the rope. Then take the rope out and try to clean the rope. Try to clean the rope. Can you get rid of all the oil on this rope? The answer is no. It's going to be sticking something of the oil. So that is what is doing the fiber with the cholesterol. So the cholesterol that is in your diet, the fiber is going to trap the cholesterol, and that is going to go away into the fecal material. Okay, so fiber is so important. Fiber is going to help us to, that's why vegetables are going to make you decrease your cholesterol levels in your blood. Okay, all right, so that is one. All right, so here we have optimal nutrition, undernutrition, malnutrition. So those are terms that are going to be related to the BMI. BMI. So please, I want your feedback for some of you, if you know how to calculate BMI. Let's start doing that. I'm going to open a new slide. Somebody can tell me, everybody's okay calculating BMI? I'm going. Ashni, are you okay with the BMI?
Can you go over it just one time?
Okay, BMI. No, I don't like this. Just a moment.
Sorry, I was drinking water.
You're drinking water? Okay, that's good. With fiber, okay? Okay. So now, BMI. BMI is going to be in relation to this. So optimal nutrition, undernourishment, overnutrition. So that we are going to classify in undernourishment, well nourished, or normal. Let's put a normal. Overweight. That is different from obesity. The next is obesity, and the next is morbid obesity. The normal is this, normal. If you go away from the normal, you increase your risk for diseases. Simple as that. Okay, so chronic diseases like hypertension, like diabetes. Okay, what is BMI? BMI is weight, the weight of the patient over the height square. Many people they have problems with the square, so it's very simple. So first of all, the weight need to be in kilograms. Kilograms. And your height is going to be in meters. For example, you have 165 centimeters, you will have 101.65 meters. If you have 180 centimeters height, you have 1.8 meters. All right, so let's suppose that we have a person who has 70 kilos. So they are going to give you pounds, right? You know how to change pounds to kilograms. I don't need to go on that. So we have kilograms is okay, and the height. They give you, for example, 5 feet 6 inches, and that is about, I don't know, is about 165 centimeters, about. So, so you just transform feet and inches in centimeters, and then you are going to change into meters. So I don't need to do this conversion because you already know, right? Okay, this conversion, 1.65. So what is the BMI of this patient? The body mass index. So don't worry, don't forget body mass index. So you put here 70 kilos divided by 1.65 meters. You can write it down like this: 70 kilos divided by 1.65 times 1.65. What does it mean? You divide 70 by 1.65, and that is going to give me, somebody can tell me?
25.7.
Melvin, how much?
25.7.
Okay, so it's going, again, tell me again.
25.7.
25.7. Okay, perfect. So this is going to be 25.7. Ah, 25.7. But then I need to divide again by this 101.65. And that is how much? Oh, you did everything already, huh?
Already everything, yeah.
Yeah. So let's do 70 divided. Thank you for that, Melvin. 65. Oh my God,
Oh, 1.65 by.
It's going to be 42. 42. What happened? Cannot erase. Oh my God, what happened? Okay, all right, whatever. All right, so it's going to be 42, and then you divide again by 1.65. And that is going to give you, as Melvin said, 25.7. So the result of this equation square, right? The result of this equation is going to be 25.7. So that is overweight patient. And there's a tables that you are going to, you're going to see the table and you are going to estimate if you are overweight, you need to decrease weight, right? So you're going to calculate your total calories and you decrease 500 kilocalories a day. And that you divide and you know how many grams of macronutrients you're going to require. So it's okay. You want me to do it again, or everybody's fine with BMI?
Thank you.
Okay.
Unmuted. Yes, good.
Okay. All right. So let's keep going. Okay. So we already know that to prevent chronic disease, 30 minutes. Exercise a day to gain weight, 60 minutes, to keep the same weight, and exercises 60 to 1 hour and a half to lose weight. All right, so we talk about the carbohydrates. We're talking about the soluble fiber. So you need about 35 grams, 35 grams and 25 grams a day in female. Say 25 grams, 25 grams, just to give you an idea, if you have a bagel cut it in half, and then another half. So that is the amount of fiber that you require in a day. And for male, it's a little bit more than that. Okay? So a bagel is going to weigh 100 grams, a bagel. Cut it in half is 50 grams. Cut it in half again, the half of the half is 25 grams. So that is the amount of fiber that you require in a day. And in male, it's going to be actually a little bit higher than that, 25% more. Okay. Okay, so we already talked about that. So body carbohydrate reference. Okay, so we already know that the values that you need to remember in general are carbohydrates, 50%. What else? Proteins are going to be 20%, and fats are going to be 30%. You need to know for the exam, in addition, that carbohydrates, 1 gram is going to have 4 kilocalories per gram. Proteins is going to have 4 kilocalories per gram. And fat, you have 9 kilocalories per gram. And alcohol. You see, alcohol, they can gain weight just taking alcohol, right? So there is no percentage here in your diet, of course, right? But here we have the alcohol is going to be 7 kilocalories per gram. 7 kilocalories. So you can gain weight just taking alcohol. All right, so we talk about that, the cholesterol, visible, invisible, that I remember the first class, so I'm not going to go on that. Okay, proteins. If you want me to repeat something, just please let me know, okay? For everybody, please.
Dr. G,
Yes,
you talked about the BMI. What about the BMR?
it's coming.
Okay, good. Thank you.
Okay, so let's talk about proteins, and the proteins, we are going to have 20 we have 21 proteins, right? Oh, sorry. All right, so 20 proteins, sorry. 9 plus 5, 14, 14 plus 6, 20. So what I want you to remember is the essential, and that is an NCLEX question, always coming. Essential or indispensable amino acids. What does it mean? We have no essential and conditional. So the main thing is this guy. Why? Because these amino acids are essential amino acids are 9. Remember 9. These essential amino acids are actually cannot be produced in big amounts in your body. Cannot be produced or are low production in your body, in our body, low production. So in order to complete all the requirements of all these essential amino acids, we need to have actually basically animal source in your diet. So that contain the essential amino acids, 9 amino acids. Now, if you don't have these essential amino acids, you cannot produce, for example, your albumin, your globulin, the immunoglobulins, etc., enzymes, okay, hormones. So all the proteins are being used for. Now, why I'm talking about that, and always I want you to apply in everything you see around you. You have some people who are vegan, right? Vegan. This vegan, a strict vegan, means that they don't have any product from animal source. So these essential amino acids is where mostly are located. So eventually these guys are going to be malnourished because they don't have all the essential amino acids to produce all what we was talking. So question for NCLEX. The one who contain, the only vegetable who contain the essential amino acids is, question for the exam, soybean. Soybean. So soybean is an important component of the diet of a patient who are having a vegan diet. Okay, we got that? Okay. All right, so here we have the positive nitrogen balance and the negative nitrogen balance. So actually the ideal will be the intake is equal the excretion, right? So there is zero balance, so that means that you don't, if you don't actually you don't need more, and you don't need actually you don't need more of that amount of protein. Nitrogen means what coming from proteins. Positive protein and nitrogen balance. For example, I want you to remember pregnancy, bodybuilders, growth is bodybuilders. And negative nitrogen balance is going to be burns and patients who have injuries. So in conclusion, what does it mean? That means that if you are sick, if you are having some disease, you need to have actually a good balanced diet with good amount of high, listen what I'm going to say, quality proteins. What does it mean, high quality proteins? That means that there is proteins that are better than others? The answer is no. No, there is no protein better than others. What I'm trying to tell you here about these high quality proteins are going to be this. For example, I want to have 200 grams of proteins. High quality protein, what does it mean? I have one steak, I have proteins this size of steak that have 200 grams. But I have another steak this size with 200 grams too. So what does it mean? That this piece of meat are going to actually have high density, high concentration of proteins in actually what we call lean meat. And here 200 grams of proteins, but they have a lot of streaks of fat, right? So that's why actually it's called high quality proteins. So in lean meat. Okay, so these patients are going to have who has a negative nitrogen balance is because they cannot excrete urea because they're using all the proteins and probably it's needed even in more quantities in your diet. So that's why you need to increase the proteins quantity. Actually, in this case, there is the Atkins diet. The Atkins diet is actually it's a diet that is going to be high in proteins. But please, this Atkins diet is not for a person who is normal because that can produce acidosis in your body and you don't want that. But the cost benefit in patients who are sick is benefit to have the Atkins diet because actually they have a negative nitrogen balance. All right, so is there any questions? Yes, please let me know. All right. So just to show you here, I like this out, the names of the amino acids. You don't need to know those. Just remember that we have 1, 2, 3, 4, 5, 6, 7, 8, 9 amino acids that are called essential amino acids. Okay, so here just to refresh here a little bit more, tissue building. Energy, you know what is the limitations for proteins and energy, proteins and energy, water balance. What means water balance? Is actually what we call the oncotic pressure. That is another function of the proteins. The proteins, this is the artery, this is the vessel. There's proteins here, proteins, and these proteins, use your imagination, are going to hold the water inside. So those are like holders. They are going to hold the water inside. If you don't have proteins here, water cannot be held inside. So what is going to happen with the water? It starts to escape, and that is going to cause edemas. So don't forget, there is many pathologies that are going to find edemas, and one of the main causes is malnourished. But please, I want you to remember something. It's not only malnourished. As always, I do a little bit more at night. So here we have, for example, you have the kidney. The kidney, you know that is going to reabsorb all amino acids, right? They're going to reabsorb. And what happens when your kidney is having a problem? The kidney cannot have this function. So what they are going to do is to lose proteins. Lose a lot of proteins in the urine. Lot of proteins in the urine. So what happened with these patients with kidney problems? They start to have edemas. Where is mostly coming, the edema most first place are in the eyes, or around the eyes, not in the eyes, around the eyes. So why? It's again puffy, right? So the eyes. Why? Because that area of the eye is very thin and actually is very flexible. So that's why accumulate fluid in the around the eyes is very common in patients with kidney disease, because the kidney is not working, are losing proteins, and that is called a proteinuria. 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 Loss of protein in urine. Okay, so let's keep moving. These are all the functions of the proteins. Enzymes, transport, albumins, structural to create tissue, repair, attract water, immune system like antibodies or immunoglobulins, and the buffer. Buffer, what is a buffer? Is the one who controls the pH, to maintain the pH in certain range. Give me one name of a buffer. Hemoglobin. What is hemoglobin? Protein. Okay, don't forget, see, they have many functions for protein. Okay, so here we have a vegetarian diets. So here we have lacto-ovo-vegetarian, lacto-vegetarian, ovo-vegetarian, and vegan. So there is different types. The vegan is the one who just eat vegetables. That's it, vegetables and fruit. Ovo-vegan is doing vegetables and fruit plus eggs, or product made with eggs. We have vegetarian, vegetables and fruits, and products with milk, like cheese, like milk, etc. Right? Butter, and some butter, and lacto-ovo. So the combination of the previous one. The problem is about the vegan. The vegan need to be rigorous, need to have a complement of nutrition with other products. Okay, so here we have the deficiency of proteins. We have kwashiorkor marasmus. Kwashiorkor marasmus. So please don't get confused with the rickets. Rickets, and the other one is what is the, somebody help me? Rickets and
osteomalacia.
Excellent. Who is that? Okay, thank you. Thank you. Osteomalacia. Okay. Osteomalacia that is going to lead into osteoporosis. Okay, so that rickets and osteomalacia is the deficit of vitamin D. Because vitamin D, what is doing the vitamin D? Absorb calcium in the intestines. If you don't have vitamin D, rickets is in children and osteomalacia in adults. That is different from kwashiorkor marasmus. Kwashiorkor marasmus is the deficit of proteins. Deficit of protein, deficit of protein, deficit of proteins. Kwashiorkor is when it's called when the person is having more than 2 years old, and marasmus is when he's less than 2 years old. How to remember? More than 2 years, kwashiorkor is longer. Marasmus is shorter. So you need to correlate these names first. Marasmus, less than 2 years. Kwashiorkor is more than 2 years. Rickets are going to be in children. Rickets is short, less age. Osteomalacia, adult, more age. So that is osteoporosis. It's going to lead to osteoporosis. Okay, so here we have the men and women. They are going to have proteins need 0.8 grams per kilogram. So that is the minimum that you need 70 kilograms. By 0.8, you need 56 grams, 60 grams per day. So that means 1.5 ounces. So can you imagine, go to the restaurant, they give you 8 ounces? Look like small, right? You want to eat 8 ounces. So it's literally an overplus, right? Okay, all right. So let's have 5 minutes break, and I'm going back for lecture number 2. No, 3, because 1, I just did 1 and 2. Any question? See, it's the same. Let's go to lecture number 3. Okay. Any question? Everybody's okay with the break?
Yes.
Yes.
Thank you for answering. I will see 6-5.
Thank you.
Thank you.
Thank you.
Thank you too.
Thank you.
Come again to the second part of the webinar today. We are going to talk about vitamins, minerals, and water balance. With the introduction we did at the beginning, I think it's going to be more easier in perspective to know what are doing vitamins, minerals, and water balance. All right, so let's start. Oh, what is this? So probably you saw that in your class previous, but why I put these guys here? Who is taking Monster Energy? Who is taking Red Bull? Rocky Star 5-hour energy. I know. I have in my mind the person or persons who is taking this Red Bull or 5-hour energy. So what is doing these guys? Look at this. We have we have a daily requirement, daily requirements of a nutrient or a vitamin or mineral. I want that just to show you when you take this 5-hour energy, what you are taking. You're taking 150% more of your niacin, that is a vitamin B3. Excess. You say it is good? No, I will say it's bad. I will tell you why. Vitamin B6. Vitamin 6, you are taking, there's not a mistake. Huh? You're taking 2,000 times, 2,000 percentage more than you require in a day. Folic acid, 100%, it's okay. But look at this, vitamin B12. This is just crazy. Look at this, 8,333% more than your daily requirements. So that is excessive. In addition to that, they are going to give you here purified water, nice, natural and artificial flavors, bad, sucralose, bad, potassium sorbate, sodium benzoate, but oh no, here's what I see. Caffeine. Caffeine is one of these guys, is like having 2 shots of espresso. 2 shots of espresso. Okay? So what happened with this? So you already know what is happening with the deficit of the vitamins. We already talked in the previous. But what happens when you have excess of these vitamins? If you have for a certain time, I would say, if you take once a week, more than once a week a day of these vitamins in excess, what you're going to have is unexplainable muscular, or joint or articular pain. So we don't know. This is actually not approved by the FDA. It's not approved by the FDA because it's considered a supplement. Herbs are a supplement. This is not an herb, but it's in that classification. Supplements and herbs are going to be these 5 energy are going, and the other ones are going to be in that category. So FDA is not approved that. It's not going to be approved. It's not approved. You can see in the label, you will not find never that said FDA approval. So that means that it's not approved by the FDA. It's controlled by the FDA, but it's not completely regulated by the FDA. Okay, so be careful with it. All right, so let's keep going. Most deficits are associated with malabsorption. What is malabsorption? Malabsorption is malabsorption means no absorption of nutrients. If you don't have malabsorption, if you have no absorption of nutrients, the nutrients are going to be concentrated in high quantities. So again, low concentration here, high concentration here cannot be absorbed. Water get into producing diarrhea. And this diarrhea, basically the malabsorption is caused by the no digestion of fat. So that's why you're going to have fecal material that is loose bowel movement containing a lot of fat is yellow, like this, a little bit darker, and very fatty. So it's going to be very, very strong smell. Okay? So malabsorption. What that is important about malabsorption? We are talking about vitamins, right? Don't lose the perspective. So that's why I want you to get focused on what we are talking is vitamins. So malabsorption means no absorption of what? Okay? So many macronutrients, but micronutrients too. So malabsorption, I told you that is basically the no absorption of fat, correct? So, and we have two groups of vitamins. Vitamins that are going to be the fat soluble, and we have the hydrosoluble. The hydrosoluble are going to be the vitamin B and the vitamin C. And the fat soluble are going to be the FADEC. Remember FADEC, vitamin A, vitamin D, vitamin E, and vitamin K. So if you have malabsorption, the causes of malabsorption we are going to see soon. I will tell you. Malabsorption, for example, you have low bile, amount of bile. Who produces the bile? The liver. The liver produces the bile. Okay, so that is what you know in anatomy physiology. The bile is produced by the liver. Please, the bile is not produced by the gallbladder, okay? The gallbladder do not produce bile. The bile is produced by the liver. And the liver is going to have the property of the emulsification. Emulsification. And this emulsification is going to produce drops, the fat, into droplets. These droplets are going to have, if you sum the area surface here, is this area surface, and you sum the area surface of each of them, is going to be more area surface when it's in the form of droplets. So the lipase are going to make effect, and the bile is going to, that is produced by the emulsification, and the lipase is going to break down better the fat. If you don't have bile, you cannot produce fat drops into fat droplets. So the digestion is going to be poor. There is no actually small components of fat, and the fat cannot be absorbed. And that produces actually this malabsorption. And what is that? The vitamins we have fat soluble. These are vitamins that are soluble in fat. So that means that if you have malabsorption, you are losing vitamin A, D, E, and K. So that's why you need to know FADEC. Fat, F, fat, A, vitamin A, D, E, and K. Okay, got it? So what you're going to do as a nurse, you're going to do is give supplements. Supplements of vitamins. Okay? Okay. Please. All right. So, okay, so let's talk about alcoholism. In alcoholism, what happened with the vitamins? The vitamins are going to be depleted, especially the vitamin B1. B1. Vitamin B1 is going to be depleted in alcoholism. And you know what? What happened with the vitamin B1 when it's depleted for a long period of time? They can lead into dementia. Dementia. Do you talk about a person who is alcoholic? They cannot actually focus in one topic. So you talk about A, then they're talking about right away in B, and then C, and D, and D, and you never have a sustained conversation. So that is a type of dementia. Dementia is not Alzheimer only, okay? So there's different type of dementia. Medications, for example, we have the INH, that is the isoniazid, that is used for tuberculosis. is used for tuberculosis. Okay, and what happened? This isoniazide, what is going to deplete the vitamin B6. And this vitamin B6 is going to produce neuropathies. They can produce numbness, tingling, etc. Okay, so just to talk about the three first that are actually most common. We are going to talk about TPN in the last lecture. Okay, so now here is just to talk about the vitamins, and the thing is this: cheilosis, glossitis, inflammation of the tongue, so red tongue. You have the tongue here. This is your tongue. The tongue is going to have like a small papillas. Okay, stay there, stay there. It's a papilla. If you touch with your finger your tongue, you see like a small, like a bumps, right? Bump. So glossitis is inflammation of the tongue. You are losing the papillas, so it's going to be very bright, very, I would say, very bright, and they're going to be very smooth. So it's not a normal tongue, and it's going to be red. Cheilosis is scaling. You have the mouth, here your mouth, and here in the areas of the corners is where you're going to have these fissures. So this actually, if you see here, the mouth is open. When you talk is open and close. When you eat, open and close. These corners are going to have under a lot of stress. So these corners of the mouth, they need to actually be repaired very often. Now, if you have the deficit of vitamins, those areas are going to be one of the first areas that are going to be involved. Now, just to conclude this portion, is not only one vitamin deficiency. Basically, when you have deficiency of vitamins, are multiple vitamins. So it's useless to try to memorize every vitamin deficiency for every vitamin. Why? Because it's going to be a combination of multiple vitamins who produce that deficit. And one of the most common for this multivitaminic deficiency is going to be the glossitis and cheilosis. So what I'm trying to tell you here is that if you see glossitis or cheilosis that are the most common, you can tell that that patient is malnourished, is having deficiency of vitamins. Okay? Oh, there you are. See how smooth and is the tongue, that when you open the mouth and show you the tongue, that is telling you that it's actually some deficiency of vitamins. We have the cheilosis here in the corner, this portion, right? And it's logical, right? So that is under a lot of stress because you're talking all day, you're eating, you're actually doing that activity. All right. We talk about that. Now let's talk about the vitamin by vitamin. Okay, vitamin A. Vitamin A is, we have different type of components of vitamin A. We have the retinol. We have the retinoic acid. We have the carotene. And we have what? The isotretinoin. This isotretinoin, probably some of you heard about this. This is used for acne, but it's basically vitamin A. Okay, we are going to see that in pharmacology. Isotretinoin can produce suicidal ideas, so that's why we need to be careful under control of the prescription of the doctor. Carotene is a pro-vitamin A. Pro-vitamin A. Provitamin A, carotene. Where is going to be? Carotene is going to be in the carrots. Carrots? Double T? Well, okay. So is actually is a provitamin A. So if you eat carotene, carrot, they're going to actually be the source to form vitamin A in your body. Retinoic acid and retinol are vitamin A. Okay, so what it's going to do is, first of all, we have deficiency of vitamin A. You know, it's going to affect the rhodopsin. It's a rod, right? The rods. And the rods. And when you walk in the darkness, so you use a rod to know where you're walking, right? So that is actually, rods are used for night vision. Night vision. Rods is the, what are the rods? Rods are receptors that are located in the retina of the eye. Okay, so rhodopsin is going to be the pigment that is going to contain the rods in order to detect a night vision. Night vision. So that means that if you have deficiency of vitamin A, you will have night blindness. It's what we call night blindness. Blindness. Okay, one thing I want to remember here is we have two different receptors, the cones and the rods. The rods are going to use for night vision. The cones are for a color. Cones, color. Okay. So now the vitamin A, I mentioned this. The cones, that is the other receptors, are not going to use vitamin A. Are not using vitamin A. The one who use vitamin A are the rods. Only the rods. Okay. All right. Okay, so let's talk about the vitamin D. Excuse me 1 second. Okay. Okay, the vitamin D. The vitamin D, we already talked about, that is the rickets in children and osteomalacia in adults. Okay, vitamin D sources. The source of vitamin D sources are going to be a diet, okay, vitamin in your diet, and the sunlight, skin, the skin. Okay, so this, what is doing the vitamin D, is going to absorb calcium. At what level? At the level of the intestines. Okay, and this produce, the deficit of these are going to produce the rickets or osteomalacia in adults, rickets in children. Okay, we got that. So here we have the bowing legs. Can you see these bowing legs? These bowing legs is going to be progressive. Why? Because the bones are weak, because they have deficit of vitamin D. They cannot produce deposit of calcium in the bones. The baby or the kid start to grow. The weight of the body, upper body, is going to be heavier and heavier, and the bones are weaker and weaker. So what they are doing is just to have a bowing. Okay, they are going to have a bowing. Okay, vitamin E. The vitamin E, remember, if you have a question, you can open your microphone, please, okay? If you have vitamin E is an antioxidant. Very important, antioxidant. So it's going to fight against the free radicals. Free radicals. Remember, fats plus oxygen, they are going to produce a lot of free radicals. Free radicals. For example, margarine, fat that is being exposed to the air environment, see, that is going to change the taste. When you see the taste, you are eating a lot, huge quantity of free radicals. And to make it more in perspective, free radicals, what is going to happen in your body? Free radicals is nothing. No, free radicals is going to make you older faster. So you don't want that. So you want to fight against the free radicals. And one of the ways to fight the free radicals is taking antioxidants, is the vitamin E. One of the high content of vitamin E is going to be the avocado or guacamole, whatever you want to call avocado. Okay. Yeah, it's a difference. Well, anyhow, so antioxidant, what is doing, especially remember the hemolytic anemia. So deficit of vitamin E. What is that? What is hemolysis? Hemolysis means destruction of the red blood cells. So why is that? If you have a lot of free radicals here on the red blood cell, this red blood cell is going to blow up. It's going to be destroyed. But who is coming? It's coming the vitamin E. And the vitamin E is going to just sweep out the free radicals around the red blood cell, and the red blood cell can reach his 120 days span life. Otherwise, there are going to be an early destruction of the red blood cells. So in conclusion, vitamin E is going, the deficit is a very important antioxidant. It's not the only one. We have vitamin C too. We are going to see that. And if you have deficit of vitamin E, they can lead into hemolytic anemia. Hemolysis, so quantity, the red blood cells in number are going to decay, and you have anemia. Vitamin K, we already talked about that. Please, the medical term for bruises is ecchymosis. Ecchymosis. So you tap your skin, and in a few minutes you start to have a bruise. That is called ecchymosis. Okay, so that is the terminal medical term. And we already explained about the vitamin K as a coenzyme participating in the formation of the coagulation factors. So, all right, so who can find here vitamin K? Where's vitamin K? They forgot the vitamin K here, yes. Okay, so now try to find the calcium. Where is calcium? See? Calcium here, the cofactor, calcium here, calcium here. Okay, and that are necessary. In some of them are going to be vitamin K. So coenzyme and cofactors participating in this example of the coagulation factor. Complex B and complex C. What is complex B? Complex B. Complex B is the group of vitamin B. So we have B1, we have B2, we have B3, B4, B5, B7, B9, B12. So we have 1, 2, 3, 4, 5, 6, 7, 8 type of vitamin B. Altogether is going to be complex B. So that means the pills are going to have all the vitamins B in one pill. Okay, all right. So this vitamin B and vitamin C are very easy, are actually water soluble. It's not fatty, water soluble. So it's easy to be eliminated through the urine. So that's why you need to take actually every single day. So you need every single day vitamins. But the vitamin C is very easy to be depleted because it can be diluted in the fluid and get excreted easily through the urine. So your glass of orange juice in the morning, that could be good. Vitamin C, what it's going to do is the ascorbic acid. One of the things produce collagen. Collagen is part of the components of the tissue repair. If you don't have vitamin C, you don't have collagen. You start to have wrinkles in the long run, but in the short term, you're going to have ulcers. So the healing process is going to be affected. Bleeding in the articulations, bleeding in the skin, poor wound healing, bleeding on the lungs, and you have bleeding here on the brain. So the patient is going to die by internal bleeding. Why? Because they didn't take vitamin C. Okay? That process is called scurvy. Scurvy. Don't forget about the scurvy. Thiamine. So let's talk about the vitamin B1. Thiamine is used, especially they are going to use for, can you imagine, produce acetyl-CoA, participate in the enzymatic reaction of acetyl-CoA. Remember the Krebs cycle, pyruvic acid, a lot of reactions. They are going to use vitamin B1 for that. And mostly the vitamin Bs are going to be for that. They are going to produce what we call the beriberi. Beriberi, loss of appetite, fatigue, heart failure. I put here beriberi because I want you to always remember the loss of appetite. When somebody are going to lose appetite, they said, you go to the doctor, and the doctor said, okay, let's give a vitamin to stimulate the appetite. So, and who is that? You know, the vitamin B1, the thiamine. Thiamine is used as a appetite stimulate the appetite in patients. Okay. Beriberi, remember berry, beriberi is a way to remember. Okay, beriberi, loss of appetite. So that is the deficiency of vitamin B1, fatigue, and heart failure. Vitamin B1 is depleted in alcoholism. Depleted. So what happened? We have the dementia of Wernicke-Korsakoff. That is the dementia in alcoholics. Okay, so please pay attention to this. Wernicke is called when it's a mild to moderate dementia. And it's called Wernicke-Korsakoff when it's a severe dementia. And that is because alcohol depletes the vitamin B1, the thiamine. Okay. Riboflavin, I'm not going to go on that. Niacin is the pellagra. Niacin is the vitamin B3. That is going to happen in patients who are eating only corn. Only corn. So they are going to have deficiency of vitamin B3, for example. And look at this, pellagra. Probably you will not see here in the United States something like this, but pellagra is considered producing dementia, dermatitis, inflammation of the skin, diarrhea, and death. The 4 Ds. Choline, the choline is, remember the name choline? Okay, is going to produce acetylcholine. That is, participate in the reactions. Is a coenzyme that is going to help the production of acetylcholine, ACH. Okay, vitamin B5. Vitamin B5. Remember that shampoo, Pantene? I don't know if I spell it right. Pantene, right? Panthenol, whatever they say, right? Why? Because the is vitamin B5. What is doing the vitamin B5 is going to promote the growth of hair growth. Vitamin B6 is going to be the pyridoxine. It's going to produce many other, going to help to produce neurotransmitters like serotonin, etc. I don't want you to remember that. What is necessary to know is that is associated with the use of isoniazide, the INH, that is used for what? For tuberculosis. So you take isoniazide in tuberculosis, that is going to deplete the vitamin B6, and that produces peripheral neuritis, numbness, tingling, loss. You lose the sensitivity of your distal portions of your upper and lower extremities. Vitamin B7, I'm going to just mention. Folic acid, we have NTDs. So you need to get familiar with this. NTDs. Neural tube defects. What is happening here? If you are going to draw a vertebra, Okay, this is a vertebra. This is the vertebral canal. That is where it's opening, where it's passing the medulla, the body, the transverse, the lamina, etc. So what happened with the vitamin B? This is the pre-pregnancy vitamin, right? Okay. So what happened here is this vertebra in the formation of the fetus or embryo fetus, they are going to be open and they are going to close. So it's going to be something like this. At the beginning, it's going to be something like that. And then this is going to get closer and closer, and they are going to form the protection of the medulla. If you have deficiency of folic acid, that closure is not going to happen. And what is going to occur? The spine is going, the medulla is going to be exposed. And from this and lower than that, there are going to be a disability, a permanent disability of the patient. So that's why you need to take your vitamin B9, folic acid, or folate. Folate, they tell you, probably you hear about more folic acid than folate. Why? Folate is the natural vitamin in the nature. Folic acid is a man-made, but what is the difference? Folic acid lasts longer. So that's why they give you folic acid, not folate. Okay? But basically it's the same. The only difference is the folate have a time life shorter than the folic acid. Cobalamin is the vitamin B12. Remember, we have cobalamin is the deficiency of vitamin B12 is going to decrease the production of red blood cells. And that is called the megaloblastic anemia. So we talk about in anatomy, in bioscience, megaloblastic anemia. What is megaloblastic anemia? This is the normal red blood cells. The red blood cells on deficiency of vitamin B12 are huge. That is called megaloblastic anemia. Megaloblastic anemia. Talking about minerals. So by the exam, you need to know some values here. The values that I want you to remember is this: sodium, calcium, and potassium. Potassium 3.5 to 5, don't overlook this, okay? Sodium is 135 to 145, and calcium 8.5 to 10. So those are values that you don't have escape. You don't have escape for those, so you need to know those values, okay? Let's talk about that. All right, so we have calcium 8.5 to 10. Surprisingly, you will see that one of the questions for the NCLEX that I saw is the highest content of calcium is, you said milk, you see actually, but broccoli is have high content of calcium. Sodium 135 to 145, we already talked about that. 3.5 to 5, the potassium. Chloride, magnesium. That is another time. Actually, we will talk about that another moment. All right, so trace elements. Trace elements are the ones who are required in less than 100 milligrams per day. 100 milligrams per day, so a very small amount. And one of these is the iron, iodine. Remember II, okay? Iodine, iron, zinc. So those are the three that basically are going to ask in the exam. Iodine, iron, and zinc, okay? Iron, deficiency of iron is, okay, all right. Talking about iron. Iron need to be absorbed with gastric acid. Elderly have low gastric acid. So if you take iron, you need to take it with orange juice. Why? Because orange juice is acid, and that is going to help the absorption of iron. Side effects of the iron: dark stools, constipation. Another, stain the teeth. If you have syrup, in the way of syrup, you need to take it with a straw. All these are NCLEX. You need to take it with a straw in order not to stain your teeth. Okay, we got it? They can produce in other presentations hypotension. I'm not going to talk about that. Iodine. Iodine is, if you remember your bioscience, anatomy, physiology, you have the hypothalamus that is going to order the pituitary gland to produce TSH, and the TSH go to the thyroid gland. So please don't tell me anymore. I don't want to hear the thyroid gland produce TSH. Please, I've said 10 times. TSH is produced by the pituitary gland. The TSH stimulates the thyroid gland to produce T3 and T4. But in order to produce T3 and T4, you need to have supply of iodine. Iodine. If you don't have iodine, you don't produce T3 and T4. Now, the mother produce their own T3 and T4. And the fetus produce his own T3 and T4. The mother is not going to give T3 and T4 to the baby. Okay? So what the mother is going to give to the baby is in her diet the iodine. The iodine passes to the fetus, and the fetus is able to produce his own T3 and T4. But if that is not the case, the baby will not have, they have normal hypothalamus, normal pituitary gland, they can have secretion of TSH, but they don't have iodine. So everything can be good, the thyroid gland good, but if they don't have iodine, the baby cannot produce T3 and T4. And T3 and T4, what it's going to do is to increase the production of ATPs. ATPs is energy. And why do we need energy? Because the fetus is growing, and they have a huge amount of ATPs. If you want to build something, you need a lot of energy, right? A lot more energy. So that's why the fetus is growing. So if you don't have enough ATP because you don't have enough T3 and T4 because the thyroid gland do not have enough iodine, and the iodine is because the mother doesn't eat or they have malnourished, the first system that is going to be affected is the nervous system in the fetus. And this nervous system are going to lead into what we call the cretinism. Cretinism in fetus, that means mental retardation. Mental retardation. Okay. Zinc. This is another question for the exam, okay? All right, so I want you to get this. Zinc is used for poor wound healing. So if you have low, or you have poor wound healing, it's because probably you have low zinc. So what you need to do? You need to think about your wound. Think about your wound. Okay, so that is a way to remember that zinc is needed for when you want to heal your wound or a lesion. You actually, zinc is going to help you to heal fast. All right, so you already know. I'm going to talk about what is the. We already talked very well this, so I'm going to have. All right, so any question? Again, welcome. We are going to continue our lecture, our review with lecture number 4.
Maitane. Oh,
Yes.
sorry. Sure.
All right, so here we have, we are going to see that during the pregnancy, you are going to require more, increase your calories intake, caloric intake. You're going to increase energy by 340 to 450 kilocalories per day during the first, second, and the third trimester. So that is actually 450 is what you mostly require every day increase of you need to eat more. Okay, so I'm going to go directly to the point here because there is so many things that we need to remark here, and I want to go straight. Okay, so protein intake should be increased 25 grams a day. Protein, the protein alone, is going to be 25 grams a day. It's basically almost 1 ounce of proteins more during the day. Okay. Calcium is needed, iron. So one thing I want to tell you, somebody get pregnant, you need to listen to your body. Listen to your body. So we have millions, a couple millions of evolution, and actually your body in that time learn what they need in order to have a normal and successful pregnancy. So don't take excess. Okay, so for example, I'm going to take excess of vitamin A. Excess of vitamin A to have vitamin A for the rest of my pregnancy. That excess can produce fetal malformations. So it can produce cleft palate, or cleft lip. So actually the lip is not totally formed. And problems for eating, for lactation, etc. consequences of that, they need surgery. And you don't want that, right? So just take what your body is asking you to have. Don't take less, don't take more. Folic acid, you need to have, is 2 months before folic acid. This is the spina bifida. If you see here, this is a baby, we have the column here. This is the skin. Below this is the vertebra. The normal vertebral is like this. Here is the passing the medulla, the normal. But abnormal vertebra is going to be like this. See, this is open. And what we have here is the muscle and the skin. And that's what is protruding here. Here inside we have CSF, cerebral spinal fluid. And this lesion, below the lesion, everything is being destroyed. So the baby cannot poo, cannot pee, cannot walk, etc. So that's why you need to take your folic acid. Folic acid, okay? Folic acid. Don't forget about the folic acid. Okay, so here we have a woman who is pregnant. We are talking about nutrition, of course, right? Normal weight before pregnancy, they are going to increase between 25 to 35 pounds. So that is what you are going to increase your, if you are normal weight, you're going to increase during the pregnancy 25 to 35 pounds. Overweight, they need to increase 15 to 25 pounds less. Obese women, around 50 pounds. So one question is, an obese woman during pregnancy, does she need to increase weight? The answer is yes. Always they need to increase weight, but in less quantity than a normal weight woman. Is that clear? So what I want you to remember the normal first, right? 25, the concept. The more heavier you are, the less weight you need to increase during the pregnancy, or you're going to increase during pregnancy. Okay, This is Olympic torch is coming for the exam. Okay, average weight gain in the first trimester. Total between the first week to 12 week, you gain 2 to 4 pounds. That is the first trimester. So you know the first trimester is 12 weeks. Second trimester is up to 24 weeks. Third trimester is more than 24 weeks. So in this second and third trimester, you're going to weigh 1 pound per week. 1 pound per week. 1 pound per week. So if we have 12 and 12 here, about is 36 pounds. So 36 pounds, 24 pounds, sorry. Plus the second is going to be 30 pounds about. So you need to gain 25 to 35 in a normal weight woman. Okay? All right, so this is question for the exam. So please, open eyes, open ears. During pregnancy, please don't take alcohol. Don't take caffeine. Don't smoke. And other drugs, of course. Caffeine, why? Because caffeine produces vasoconstriction of what? Of the placenta, umbilical cord. So there is low oxygen supply to the baby. Alcohol, they have some effects. If you have 1 cup of 1 glass a week, that's probably okay. But 2 cups a week, now later studies, they say more than 1 cup, they can produce the reproduction of the nervous system is going to slow down. So what happened? The baby is going to born with less nerve cells that should be. So in the past, I was suggesting just alcohol is okay once in a while, but no. At this moment, I would suggest not to take alcohol at all, okay, during pregnancy. Even though that is allowed to say once a week, but I would say never take alcohol during your pregnancy. Okay, so I want to go over the values that we need to remember. Just a moment. Okay. Any questions about this lecture? Any doubt or any let's talk about the cow milk. All right, so you know the stimulation of the nipple suckling stimulates the milk production, right? So that is going to increase the production of prolactin and increase the production of oxytocin, production of milk and ejection of the milk. So how is going to be stimulated? By the suckling of the infant. Okay, so cow milk. Please, this is very important. No cow milk in less than 1 year old. No cow. I mean, no cow milk in infants. What is an infant? Infant, listen, infant is 1 year, less than 1 year. Okay, infant. Okay, less than 1 year. So the cow milk is good, right? But it's not humans. It's not humans cow. It's not human milk. So it's basically there is a difference between them, and the difference is the cow milk. The cow milk contains a protein called the casein. This casein cannot be breaked or digested by the neonates, so that produces diarrhea. So don't give it to less than 1 year. Okay. Now another thing. Don't give another question for NCLEX. Don't give honey. No honey in less than 1 year. No honey. Okay? Why? Because there is cases of botulism. Botulism. What is botulism? Is flaccid paralysis. So that means your muscle is totally relaxed, cannot contract. Botulism. Okay? And this botulism is given by the Clostridium botulinum. That is a gram-positive. No in milk. No milk in less than 1 year. All right. So the honey basically is coming. They're coming in containers who are glass, right? So it's a glass container. A glass container. I'm going to show you a trick about this. This Clostridium botulinum, especially if you have a can that is bended, something like that, bended. This inside the can, there's actually a cover here and the lining in the inner surface that is going to protect the food to be in contact with the metal. When you actually bend the can like this portion is broken. So the metal is going to be in contact with the food. And that is what who like that? The Clostridium botulinum. Conclusion, if you have a can that is damaged or bended, just disregard it, just pass it. Choose another can. Another thing, this is not a can, but it's a glass. How do you know it could be a Clostridium botulinum here? You're going to put your finger here and press the top. If you press that cover, shouldn't be like a click, any clicking. Click, click, no. Should be flat, completely flat. If you have some click when you push the cover, click, click, is because there is some air inside. And that air inside probably is very likely to have Clostridium botulinum. Okay? Okay. All right, so cow milk contains number of potential allergy causing proteins human cause milk doesn't. Casein is the one. So it can be allergy or it could be no digestion. Both actually. Okay, so here we have the growth chart. This growth chart is the best way to measure the growth of the child. So this is 10 percentile. So what does it mean? So actually what they do is to do these charts, they take like thousands and thousands of children that they have, for example, 3 months here, 3 months, and they measure their weight, or many of them. And basically, most of them are going to be in this range, between 12 to 14 pounds. So that make a chart. Then, if you measure at 9 months, the majority is going to be about 21 pounds to 20 and a half pounds. So that is the range. 20 pounds, sorry, to 19 pounds about. So if you have the median or the average, the curve is going to give you this. If you go in this area, or this area below the average, that means that is normal, 10%. But if you go over the other percentile, 20% difference, that is already considered abnormal. So if you have overweight, that means if you are passing above this line, it's overweight, obesity. If you are below this line, it's going to be malnourishment. So the best way to accurately assess the growth of the baby is these growth charts. Okay. All right, so let's go to the last lecture. Any questions, please? I'm open to questions. Everybody's tired, huh? Oh, okay, so that is, okay, let's go.
So for pregnancy, it said the best source of calcium while pregnant is milk. If you have a patient who's vegan, would them drinking not like non-dairy milk still give them that enough calcium, or then is it better for them to take a supplement?
Yeah, in this case, you need to, that's a good question. Broccoli.
Okay.
Broccoli have a high content of calcium.
Okay.
Okay,
Thank you.
sure. All right, so let's continue. Here we have weight management. For this, I'm going to start doing what? All right, so this is a value that you must remember. The BMI, body mass index. Underweight, when your index is less than 18.5, normal, between 18.5, including 18.5, up to 24. Overweight, 25 to 29. We found out that person that we was calculating was overweight. Obese, more than 30. So underweight, what you're going to do is to put more 500 kilocalories per day. Normal, you equal, you don't do anything. Overweight and obesity, you decrease 500 kilocalories, 500 to 1,000 kilocalories per day. Okay, so when you're going to start knowing what are your needs or requirements for nutrients or diet, you start to do your VMI. Is that clear?
Mm-hmm.
All right, so to lose 2 pounds in 2 weeks, decrease 500 kilocalories per day. Okay, so that is actually the limit to lose a more durable loss of weight is going to be between 0.5 up to 1 pound, 2 pounds per week, no more than that. So those are who are happy to lose 2 pounds in one day, and the next day, oh, I lost another 2 pounds. You're losing just water and
Glycogen.
glycogen. Excellent. We need to have certain amount of fat in our body. 3% the minimum in male and 8% in female. When you have this, because fat is required, because fat they have other functions that probably we are going to talk in pharmacology. For example, fat can produce estrogens. Okay, and they are going to alter the let me say the homeostasis in female when actually they have problems with menstrual cycle. Athletes, for example, who are very thin, lean body, they are going to have problems with menstruation, okay, like a no menstrual period for long periods of time. Okay, so here we have all these fat diets. Talking about the fat diets, I know that you was talking about that. There's many of them. None of these are useless, are useful. All of them are useless. Okay, so there is no magic. There is no magic way to lose weight just doing nothing. So for that, you need to have your balanced diet and exercises. Your plate, you have balanced diet right now, 50, 30, and 20%. But now you need to lose weight. You're going to have your plate like this now, 50, 30, and 20%, in few words. Okay? So just remember, to have a permanent or more steady, continuous, permanent, lasting loss of weight, you need to have two things: your balanced diet and your exercises. Okay, talking about surgery, and this is the last part, I guess. So we have the different type of surgery that mostly are going to be used for morbid obesity. Morbid obesity. They are going to have the RUX and a Y gastric bypass. That is the gastroduodenojejunostomy. That is, the food is going to go in this way now. Okay, and this is going to be bypassed. We don't take the organ, but definitely, yeah. Actually, they have we have a silicone band. This band is going to be you can remove the band. So what happened? You feel like you are filling up your stomach faster than before. So you have the sensation to be full. Okay. Everybody knows about the leptin and the ghrelin. Everybody getting that? So I don't need to do that? Okay. If somebody want me to go on that, just let me know. Leptin and ghrelin.
Yeah, you can go over, Dr. G.
Who is this?
Melvin, you can go over them.
Okay, Melvin. Thank you. So you want to talk about it?
No,
Yes.
I want you to explain that.
Oh, okay. 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 Leptin. Leptin. Ghrelin. Leptin is produced after meal. After you eat, leptin is going to be produced by the lipids. And then the lipids, there is some background there. The lipids are going to go to the central nervous system and telling you, you know what? I'm satisfied. I don't want to eat anymore. Ghrelin is going to be produced by the stomach. Empty stomach. And that is going to stimulate the appetite. In other words, you are hungry. Hungry. Okay? How to remember this? Look at this. What is this? H. What is this? H. So ghrelin produce hunger. Leptin the opposite. L, leptin. So somebody is having noise in the background, so please. Okay. So leptin, close to your microphones. If somebody have noise around you, please. Leptin is going to be produced by the lipids, LL, lipids, leptin, and that is going to make you feel satisfied. Okay? Okay. Realistic goals. So in order to do this, you need to have realistic goals. You need to lose about ½ pound to 1 pound. You can go up to 2 pounds. You need to have negative energy balance, so you need to decrease your caloric intake in 500 or up to 1,000, no more than that. Okay? Okay, so I'm going to go to the portion I want. This is the, all right, these slides are just incorporate, just to, because I was planning to do this at the beginning on the board, but I'm going to do it. I incorporate these slides. I'm going to explain how we are going to calculate our caloric intake needs. All right. So first of all, you remember we was talking about the BMI. And the BMI, you know, if you are under weight, or you are normal, or you are overweight, or you are obese, or you are morbid obese, right? Second, you're going to calculate your BMR. What is BMR? BMR is basal. So here, basal metabolic rate. Basal is the base. So what it means BMR? BMR, basal metabolic rate. So is the minimum energy that you require in to be alive. What does it mean? When you sleep, you use energy, yes or no? Yes. You're using because your heartbeat, right? And the heartbeat is just not by magic. They need to use energy, right? They are going the respiration rate, the respiratory rate. The respiratory rate, the respiratory rate is going to use energy. So those are the minimum requirements, electrical impulses in your brain, whatever is when you are sleeping, you are using energy. So that is the minimum that you can get. All right, how to calculate the BMR? The BMR, let me see if the next one is, yeah. No, okay. How to calculate the BMR? The BMR, basal metabolic rate, are going to be two different in male and female. All right, so the basal metabolic rate are going to be in male 1, in female is going to be 0.9, plus the kilograms in weight, no mass, no, it's times, kilograms, times 24 hours. Simple, right? The BMR. So that is the basal metabolic rate. So that is the minimum energy that you need in order to be alive. In order to be alive. And this is TDEE is the total daily energy expenditure. And that is the amount of kilocalories that you need to consume a day. The TDEE. Total daily energy expenditure. What I read it down. There you are. TDEE. We got it? So that is the TDEE. Imagine, please think about how much energy you're using a day today. So first of all, you need to have all the energy that you require to survive when you are sleeping. Okay, for example, the respiratory rate, cardiac, etc. Then, when you have the baseline, you need to multiply by the activity factor. Activity factor. What is activity factor? Activity factor is, where is the activity factor? Okay, there you are. Activity factor. Sedentary, you are not doing anything. Light, aerobic exercise 45 3 times a week. And that is where you are, because you're a student. Okay? Moderate, well, not necessary, but okay. Moderate exercise 1 to 3 hours, 1.5. So after you find the BMR in male, 1 times kilograms times 24, you need to multiply by the activity factor, 1.4, 1.5. Let's do one example. From the top of my head, I will see something. Okay. Okay. Let's calculate. All right, so let's do the TDEE. TDE is the BMR times the activity factor. Let's suppose that we have activity factor 1.5. How much is 1.5? You don't need to remember that, but there's a table there. 1.5 is moderate exercise. 1.5. So we're going to put here activity factor 1.5 moderate exercise. And then we have TDEE. Let's suppose that we are normal weight. Okay, let's suppose that we have normal weight. So let's do in ml. That is easy to calculate. 1 kilocalorie per the weight in kilograms. Let's put it 70 kilos in 24 hours. Right, in 24 hours. And that is how much? 7. Okay, so I can do this. 70, 28, 14, 16. So 1,800 kilocalories. That is actually your BMR. This is the BMR. Then you're going to multiply by the activity factor. Activity factor moderate, we agreed we are 1.5. And that is going to be 840. How much is that? Okay, so I don't want to see. Oh, 1.5. 2,520 kilocalories per day. Everybody got that? Everybody
Yes.
got? Okay,
Yeah.
perfect. Now,
Yes, doctor.
now, what do you want to have? What do you want to have for diet? You want your carbohydrates, right?
Mm-hmm.
50%. Your proteins, that is 20%, and your what? And your fat is going to be 30%. So that means from all these kilocalories, you're going to have 176, right? Kilocalories of carbohydrates per day. 20% is 504, right? Kilocalories per day of proteins. And the rest is going to be divided by 3, 0, 3, 84. 80, what? No, I'm tired. Okay, sorry. It's 75, 75. Are you sure? No.
How do you get those numbers?
Okay, so that is a lot. So all these, the summation kilocalories, right? So that is your kilocalories for each of the macronutrients. We got that? Everybody got that? Everybody got that, please?
Yes, sir.
Okay.
Yes. How did you get those numbers?
Okay, I will do it. So you calculate the TDEE, correct?
Yes.
Right?
Mhm.
2,520. From this
Yes.
2,520, 50% will be carbohydrates.
So you're
The
just
20
getting the 50% of the 2520 and then 20% of
But
2520
the
and
number.
30% of 2520, right?
Exactly.
That'll be a
Okay.
different number, Dr. G. It's 1200,000.
1260 is the first one.
Yeah.
What?
Instead of
1,000.
1760 is 1260.
Oh,
Yeah.
Or
12.
50%, yeah.
Okay. Yeah, I don't recall from my last part of this. Okay, how much is that? 1,000?
And the other
1200
one,
and 1260.
1260. Yeah.
Thank you.
Okay. All right. So from this, how many grams of carbohydrates you're going to get? So if you do a simple conversion, 1,000, I'm going to try to make it easy. 600 kilocalories times
4.
4 kilocalories is 1 gram. Right? Right? Yes or no?
Yeah.
The
Yes.
kilocalories and kilocalories goodbye, and you divide 1240 divided by 4. It's 670,
15.
350, right? So 315 grams. Can you see that? Easy, right? The same thing here. Proteins, 404 kilocalories times 4 kilocalories, 1 gram. And you divide that. 25, 2, how much is that? 126 grams. And the proteins and the fat, sorry, is going to be 756 kilocalories times 9 kilocalories in 1 gram, right? So kilocalories will go 756 divided by 9 is going to be 84. Are you sure? Oh, no, I can do it. Yeah. Oh, no, it's 70.
84, yeah.
Yeah, it's, yeah, because it's 84, yes.
84.
84 grams. So, are you prepared with your meal? You need to have about 50% is going to be 315 grams of carbohydrates. 30% are going to be 84 grams of fat and 126 grams of protein. Got it?
Mm-hmm.
And that is what you're going to do. Now, if you go back to the, there is more. If you go back here, look at this. I want you to pay attention to this. What's happening? Okay. So pay attention to this. You are actually normal weight. Your formula ends here, up to here, up to the activity factor. But you need to add, if you have injury factor, if you are sick, if you have a disease, so obviously you need more caloric intake. In addition, you can add 500 kilocalories if you are lactating. Or you can add 300 kilocalories more if you are pregnant. So that is the whole game. So with that, you can tell even how many grams of each macronutrient you're going to get into your diet. Is that clear?
Yes.
Yes.
Okay, good. Okay, I know that you talk about diabetes. I'm going to skip that for pharmacology because there's a lot to talk about diabetes mellitus. Any question about diabetes?
No.
All right, so the only thing I want just to tell you about diabetes is this. Diabetes mellitus, the treatment is going to be, especially, what is the most common diabetes, type 1 or type 2?
Type 2.
Type 2.
Type 2. 90% of diabetes are going to be type 2. Diabetes type 1 is 10%. We have about 32 million people in the United States with diabetes and 1,200,000 new cases every year. Pre-diabetics, we have about 6,000, so 4 times more of it. Okay, 5 times more. Okay, so now, what I want to know is the treatment for specifically diabetes type 1, type 2, sorry, diabetes type 2, this is the majority, is going to do what? It's going to be what?
Diet.
Diet
Exercise.
and exercises. Nutrition, that's all what I want you to know. Okay, so what percentage of the food you're going to have? Please, no matter what, your balance is going to be basically the 50, 30, and 20%. There is a range. There is a range. For example, you need to decrease a little bit more, you need to decrease the fat and increase a little bit the protein. Carbohydrates, decrease a little bit the carbohydrates. So everything needs to be unbalanced. So that's why we have a range of values. Is that clear? But always a balanced diet is substantially about 50, 30, and 20%. Is that clear?
Yes.
Yes.
Okay. Well, you know what? Coming back to this is my first talking about physiological situations. The patient is normal, overweight, well, it's not pregnant, lactating, what are the requirements? So now, based on your PowerPoints and presentations, you're going to talk about problems of the GI tract. So, problems, for example, what to do when you have ulcers, what happens when you have GERD, etc. We are going to see that now. All right, so BMI, is all news, right? You know how to calculate BMI. And by the way, in the exam is coming a sequence of questions. So if you answer one question wrong, the next question is going to be for sure wrong. So you need to calculate the BMI, then calculate the BMR, calculate the amount of kilocalories for carbohydrates, for proteins, and for fat. Fair enough, right? So that is what we need to know for nutrition. Okay, perfect. Everybody's happy. All right, so let's go. So this is the aphthous stomatitis. That is mostly happen when you have side effect of drugs or, for example, lack of vitamins. It can be caused by virus. It can be caused by virus. Okay, swallowing disorders. Talking about swallowing disorders, you're going to have, for example, elderly people, right? Elderly people. Tell me one thing, elderly people who is sitting on the table actually doesn't want to eat. Number one, check the dentures. Probably they don't have dentures. It's painful when you don't have dentures. Choking. Fear. Okay? So those are problems of swallowing. Swallowing problems. The patient doesn't want to swallow. So what to do? Number one, give a small, change the texture with puree. Then give a small spoons. No straws. No straw because when they take the fluid, it's like a bullet going to the throat. So don't do straws. Okay. All right. So that is in elderly people. Now we have here when somebody is choking of Alzheimer, for example, Alzheimer, Parkinson. So those are actually common situations where the patient's having risk for strokes. For choking. Okay.
Okay.
So what we are going to do is the Heimlich maneuver. Heimlich maneuver. You are not pushing the intestines. You are actually at the level of the diaphragm. And what you are doing is to squeeze the thorax in order to make air push away the thing that is being block the airway. Do it with all the strength you can. I want broken ribs. Okay? Why? Because I prefer broken ribs than a dead body. You're right. Okay, we got it?
Yes.
Here we have the esophagus. This is an X-ray. Is actually the what we call fluoroscopy. And what happened here is that is giving a contrast substance called barium that produces radioactivity. When you swallow, that is taking about 10 to 13 seconds to swallow down to the stomach. So this is the mouth, esophagus, and the stomach is here. Here's the stomach. Now, if you see here, the esophagus should be this way, this size. but the contrast substance is not filling up all the space. So what does it mean? That there is a narrowing. So the esophagus, instead to go like this, they go like this. See? And that means a narrowing of the esophagus. That is called achalasia. Question for exam. Is a narrowing, and that can produce difficult to swallow. Imagine the food is being blocked here. So you feel that something is coming down from the esophagus, but it's taking more time because of this narrowing. This narrowing is characteristic, can be spasms, or it can be gastric carcinoma, gastric cancer. Okay, so what is achalasia? Is a narrowing of the esophagus. Gastroesophageal reflux is the GERD. All right, so this is here the stomach, this is the esophagus, here is the diaphragm, and here we have a sphincter. The sphincter are actually in the wall of the esophagus. We have muscle that are going to be like a circle here. So they open the chyme, the bolus pass to the stomach as a chyme, and when they pass, they close again. So what happens when you have some irritants? When you have, for example, spices, spicy food, hot food, very hot, chocolate, fat, okay? So coffee, smoking, that all of these increase the amount of gastric acid in the stomach. So when that gastric acid increase, this irritation produce a relaxation of the sphincter. And what happened? The gastric acid go to the esophagus. And the esophagus is not the stomach. The esophagus do not have the mucus that is covering the stomach. So the gastric acid that go from the stomach to the esophagus is going to produce ulcers. In the long run, these ulcers produce a replacement of tissue into fibrous tissue scars, and that can lead into achalasia. So that could be actually the narrowing of the esophagus. All right, so peptic ulcer. Oh, okay, so one more thing. So what to do with these patients? The GERD, you need to avoid spicy food, hot food, chocolate, fat. If you have gastritis, you're not going to eat fat, right? Coffee increase the gastric acid, smoking increase the gastric acid. So you need to prevent all these guys. No more of these things. And what else? You need to have in who can tell me?
Fowlers.
Semi-Fowler position. Why? Because if you lay down, all the gastric acid go to your mouth. So you need to sit up in semi-Fowler position in about 30 to 1 hour after meals. PC is after meals, correct? PC means post-sebum that we use in nursing a lot. Okay? After meals. All right? All right, and then one more thing. Don't wait more than 2 weeks. Everybody has gastritis once in a while, right? And you go to Safeway or CVS or whatever, and you find some medication called over-the-counter medication, OTC. Pyrrolose, ranitidine, famotidine, cimetidine, whatever, right? So, and that is going to be resolved. But if that is going to last, for example, today I have gastritis, tomorrow I don't, in 2 days I will have again, then I start to have take medication, I don't have it for 2-3 days, and I start again. If that is the story, in 2 weeks you must go to the doctor. You cannot wait more than 2 weeks because it could be something more serious. So that is Enckel's question. One of the cons of the OTC, over-the-counter medication, is that make the patient wait too long to go to the doctor. Because OTC, over-the-counter medication, listen to this, very clear, open eyes, open ears, OTC do not cure any disease, do not cure nothing. Nothing is being cured for any medication that you found over the counter. None. What they are doing there is to calm signs and symptoms, to relieve signs and symptoms. Anything else. Okay? Peptic ulcer. The peptic ulcer is going to be, actually, it's called, we are going to have, for example, here we have the antrum. This is the antrum. This is the pyloric area. This is the fundus. No, sorry, the body. This is the fundus. Okay? And the gastritis basically is going to be on the bottom. Why? Because basically the gastric acid goes by gravity to the bottom of the stomach. So that is why the most common ulcers are going to be at the bottom of the stomach. Pyloric ulcer, antral ulcer, or duodenal ulcer. So all this area, all this duodenal ulcer, gastric ulcer, any position is called peptic ulcer. Mostly associated with the H. pylori. We are going to talk about, I talked already about that, H. pylori, and associated with 90% of cases of cancer of the stomach. Malabsorption. Steatorrhea, steato means fat. Elimination of fat through the stools, steatorrhea. I'm not talking of here. Inflammatory bowel disease, IBD. We have two types, the Crohn's disease and the CUC. Is the chronic ulcerative colitis, means colon, right? This Crohn's disease and CUC are basically autoimmune disorders. Where is that? It's not here. Okay. Autoimmune disorders. It's an autoimmune disorder. So you are actually, it's going to be inflamed all the time. What another difference? Crohn can happen from the mouth to the anus. And CUC, as I say the name, basically is going to be in the colon, especially in the distal portion of the colon. Okay, so we are going to use actually high quality proteins. We don't want the GI tract to work harder. So we are going to have high quality proteins. When you have high quality proteins that give you the exact amount of proteins that you require, fats and some carbohydrates. So balanced diet again. Increase vitamins and minerals. Why? Because this inflammation of the intestine here are going to prevent the absorption of nutrients. Diverticulosis. Diverticulosis is going to be the outpouching. Where's that? Outpouching. Outpouching of the mucus of the intestine. So look at this. This is like a weak area. This is going to, all the mucus is coming in. See, all is going to protrude. That is called the diverticula. This is passing fecal material that is get trapped here, and now it's going to be called the diverticulitis. diverticulitis. So what you need to eat is avoid nuts and seeds. Why? Because the nuts can get trapped here, right? And that can produce the inflammation of the diverticula and produce the perforation, and the fecal material go to your abdomen. Irritable bowel. Irritable bowel, we are going to see that these are the patients who are basically going to the bathroom for whatever reason. And we are going to have high levels of carbohydrates and low in fat. So if you're nervous, you're stressed, you go to the bathroom. You push, nothing is coming. You try to stand up, 5 seconds, you come back again because you have the same needs. So that is an irregular peristalsis during the GI, during the whole, especially the large intestine. Okay, so I'm not going to go over all this. I think we are. Oh, you did kidney disease with George already?
Yes. Yes.
Okay. No, I'm sorry. All right, so here's something that I want to know. Okay, let's do the extra mile. Okay. All right, so constipation. All right, constipation, what you're going to do is increase the fiber, and you already know why. Okay, fiber is going to increase with a lot of water. You need to give a lot of water in order to prevent a constipation. Remember, is that you're constipated 2 days or more, you have what we call impactation. And you're going to have a not very welcome enema. Okay, constipation. For that, you need to increase your fiber. Where is the fiber? Fruits, vegetables. You can use some soft laxative, fluid intake, always. All right, so we have allergies and intolerance. For example, you have peanuts. Peanuts is a very common factor of allergies. So in allergies, you have risk for anaphylaxis, anaphylactic shock. What is anaphylactic shock? Look at this. Anaphylactic shock. Anaphylactic shock. Shock. All your vessels are going to produce vasodilation. And when that happens, your blood pressure go down. Because the peripheral resistance is going down. Right? And that anaphylactic shock is equal to peanuts. So what happens is that allergy, that is different from intolerance. And intolerance, you have the lactose intolerance. Lactose is a disaccharide that they need to be transformed into what? Into galactose and glucose. Okay? So for this, you need an enzyme. It's the lactase. If you don't have this lactase, the lactose cannot, that is a disaccharide, cannot change into monosaccharides, mono and mono. So this is never happened. Lactose is a disaccharide, cannot be absorbed. If they cannot be absorbed, the same story. Here we have high concentration of lactose, but they cannot be absorbed. What happened? Water come in. Osmotic diarrhea. And that produces diarrhea. Okay, so please, in the in the in conclusion, the food allergies are involved the immune system. In food intolerance, there is no involvement of the immune system. All right, celiac disease is a gluten-free diet. Please, what is gluten? Gluten. Many people say, "Oh, gluten or glucose." No, gluten is not a carbohydrate. It's a protein. A protein that actually you have sensitivity to the gluten. It's a type of allergy. Okay. Hepatitis. Hepatitis. Here we have healthy liver, cirrhosis, fatty liver. So fatty liver is deposit of fat in your liver. Good news is that it's reversible. If you go the proper diet, 6 months. But they can resolve, or they can be one of the causes. Not only alcohol is the cause for cirrhosis. Fatty liver, too much fatty liver for many years can lead into cirrhosis. Okay? Nice liver, right? Look at that. Nice liver. Poor liver. That is cirrhosis. The liver complains when you have 80% of the liver destroyed. Before this 80%, the liver do not complain. You don't have signs and symptoms. When it's detectable, it's too late. Okay. Okay, so the rest is pathology, and we already talked about that in the. I just want to remark a few things here. There is 2 types of diseases in the kidney. We are going to talk about the nephrotic syndrome. I'm going to write it down. I have space. Nephrotic and nephritic syndrome. This is nothing to do, okay? Nephritic syndrome. Nephrotic syndrome, you lose proteins. Nephrotic syndrome. Example of nephrotic syndrome, diabetes mellitus. Example of nephritic syndrome, glomerulonephritis. That is caused by, for example, strep throat, by the toxins of the strep throat. Strep throat, streptococcus. Okay, so nephritic syndrome, you're going to lose red blood cells, and is characterized by hypertension. So that is the 2 things that you need to remember: nephritic syndrome and nephrotic syndrome. Okay, guys, I think we are going to stop here, and that is what I consider that is relevant for this course. The most important part was to learn how to calculate your daily amount of kilocalories. Okay. Okay. So now I'm going to give 40 minutes for the exam. I'm going to have a break right now, and we are going to start at 8:15. Is that okay? Or you want to start right away? 8:15.
Yeah, that's fine, I think.
That's fine. We can start at 8:15.
Okay, 8:15. Take a break, and we are going to just start the exam at 8:15.
Okay.